Welcome to our latest cast for the new Norfolk and Suffolk ICB. Today, we're going to have a bit of a focus on the new 5-year population health and commissioning strategy for 2026 to 2031, which has been published. Its main aim is, of course, to improve the health and care services for people living across Norfolk and Suffolk. Now, today joining us, we have Richard Watson, the Deputy Chief Executive and the Executive Director of Strategy, Digital and Commissioning of the Norfolk and Suffolk ICB. And also Dr. Alex Royan, who's the Director of Strategy and Healthcare Intelligence for the new ICB as well. Welcome to you both. Thank you for joining us this afternoon.
Hi, Simon. Thank you.
Richard, let's start with you, if you don't mind, with a bit of a basic question, but one that needs to be asked, of course. What is the population health strategy all about?
Thanks, Simon. So at its heart, our strategy sets out how will we help to keep people in Norfolk and Suffolk living longer, healthier, happier lives. So not just about running services. And it really brings together, as hopefully colleagues will see, our vision, our ambitions and our commitments into one key plan for the organisation. So decisions about services are driven by what matters most to people's health in that plan, not organisational boundaries. And we're focusing on 3 key outcomes working with the population. The first is improving life expectancy. Second is reducing inequalities. And the third is improving access to high quality care. And all 3 of those are equally important within our strategy. And this really responds directly to what people have told us. So they want joined up care, easier access, prevention, and a more compassionate care in how we provide it. And the strategy tries to respond to that. But it really reflects the reality of what we're facing, that never-ending rising demand for services, that ageing population, particularly as a feature of both of our counties of Suffolk and Norfolk, workforce pressures, and the need to get complete value for every pound we spend. So this is really now about moving us from an NHS that reacts to illness to one that actively supports people to stay well, while still keeping a keen eye improving access and performance for our local population.
You mentioned there, Richard, the strategy recognises that health is so important, and it's shaped also, isn't it, by more than just healthcare alone, including factors such as housing, employment, education, and community connections as well. How important are those other ingredients to this?
I don't think we can deliver what I've just described in terms of that vision and those 3 key outcomes without continuing to work really closely with our partners. We just cannot deliver that. Much of what we need to achieve in improving health outcomes actually will only be achieved if we sort some of those wider determinants, whether, as it said, Simon, housing, economics, so access to job, strong education. So you'll see within the strategy, we've really lent into that with some of the work that we've set out within it.
Brilliant. Alex, just turning to you, if I may, please. How will this strategy seek to improve local people's health long term, do you feel?
Yeah, so Simon, the whole strategy is about pivoting the ICB towards being much more focused around population health, and as a part of that, commissioning to improve very specific population health outcomes. So I think it positions the ICB being much more focused around responding to the local health needs of our population. The way it does that is by building on an integrated needs assessment, which we developed with public health colleagues. That sets out the health of the population today and how we think that might change over time, and what the kind of key drivers of that change are. And in particular, through our outcomes and our ambitions, it places prevention and it places proactive care right at the heart of our ambitions. And you can see that in the very specific vision that we have. The strategy also then starts to go into much more detail around very specific population cohorts that we think we need to be much more focused on as a wider health and care system. So who are the groups in our population that are already at high risk due to having long-term conditions, or they're frail and they have a high level of need for urgent and emergency care, through to those individuals that are maybe at risk of developing some of those conditions over a longer period of time. And that will allow the ICB and its health and care partners to be much more targeted in the way that we deliver care. And I think in addition to that prevention, we're also placing a really strong focus on reducing health inequalities. And that's a kind of golden thread that just runs through the whole of our strategy. It's one of our overarching 3 outcomes, is to try and reduce health inequalities. And through the strategy, we're identifying the very specific groups who have historically experienced the worst health inequalities. We're putting them at the heart of the strategy and making sure that we do more to target resources towards them.
And just staying on health inequalities there, you mentioned that in your last response, some of the most deprived communities within the patch, and indeed elsewhere around the country, early deaths are around 70% higher, and around 6% of working age people are unable to work due to health issues. That's quite a stark figure, isn't it, Alex?
It is, yeah, and it's a kind of a product of kind of broader societal and kind of economic challenges, and that's kind of context within which we sit. But I think we have to recognise our role as an integrated care board, that we have a duty to try to address some of these health inequalities going forward, and we do have the ability to do that with the resources that we have. We've just got to be so much more sophisticated in the way that we target our resources, be very data-led, be very responsive to our communities, listening to what they tell us in terms of where the level of need is, where it's greatest. And as, like I say, try to be much more specific in the way that we distribute resources to really target those communities where health inequalities have been experienced the worst.
Okay, Richard, back to you. We know that this is a 5-year plan, but within the 5 years, have you got any key timescales or actions that you would like the ICB and partners to achieve?
Yeah, so the strategy, as you said, Simon, runs for 5 years, and it's a rolling 5 years, so it'll be refreshed on an annual basis. So Alex and I will be ensuring every quarter that we've got a sense of how we're achieving against it, and then there'll be an annual, effectively, review and refresh. And what we've tried to do within there is kind of be responsive to the position that we find ourselves in and within the wider NHS, particularly around the challenges that still remain a legacy of COVID around access and performance, but actually still within that bigger ambition of achieving those 3 outcomes I outlined earlier and Alex has also alluded to. So within the first 2 years of the plan, we're very much focusing on recovery and stabilisation of services. So that's improving access performance, addressing quality and safety risks that we have within the NHS sector, and really importantly, putting those strong foundations in place for neighbourhood health. So particularly the work that Maddie and Mark are leading on in their roles, we've absolutely got to get going on those alliances and those neighbourhood teams. When we turn to years 3 and 5 of the strategy, we are very much focusing more on that longer term ambition for change. So as Alex and I have alluded to, shifting more care into the community. So building on those alliances, those locality teams, really moving further on prevention and early intervention. We always talk about that. We've made strides to do that. We've got to make an even bigger step change to achieve that. And really importantly, getting much better at using digital and data to redesign our services at scale. I just want to make a plug, though, at the same time, it would be great if colleagues can look at the population health improvement plan. So absolutely, we've got our strategy, but we've also then got our plan that complements it to deliver. Both were signed off by the board, and that sets out our more detailed intentions with timelines very specific. So whether you're working in urgent emergency care, whether you're working in learning disabilities, there's a section within that that sets out the specific commitments that we've given to implement over the next 5 years.
Okay, thanks, Richard. Alex, just back to you. Can you just outline quickly what public engagement has taken place with regards to the development of this strategy?
Yeah, so the strategy responds to a combination of kind of national policy drivers and local policy drivers, all of which has been informed by public engagement. So if we look at the NHS 10-year plan, which in particular embeds this concept of kind of shifts in care towards community-based care, moving care closer to home, making care having more of a focus on prevention, for example, these are things that have come out as really strong themes from community engagement, and the NHS 10-year plan has been the biggest engagement exercise in the history of the NHS. So it very much by embedding kind of some of the principles of the 10-year health plan is kind of responding, I think, to the key messages coming from the public. It's also about trying to respond to some of the kind of local policy drivers, particularly those things that comes through the health and wellbeing strategies, and also carries through some of the key themes that have come through joint forward plans, all of which have been informed by our own local engagement exercises. So the strategy is very much about trying to triangulate, the national policy drivers, the local policy drivers, the intelligence that comes from our local data, and the intelligence that's coming from conversations with local communities, and tries to bring all that together to bring to life a kind of coherent set of principles that responds to the kind of the needs of the local population.
Okay, thank you. Richard touched on it a little bit earlier, but how will you measure success with this strategy, Alex?
Yeah, so there's a few different layers to this one, but fundamentally what we're going to try and do here is be quite outcomes focused, and the real way in which we'll know whether or not this strategy has been successful is if after 5 years we've actually started to see a shift in some of the key measures of population health. So we've put in our kind of 3 outcomes that we want to see evidence of. We're reducing some health inequalities, that we're actually starting to see a reduction in waiting times for people for really important NHS services. And crucially, as a kind of overarching measure, we want to try and see some improvement in healthy life expectancy. So we know that people might be living longer, but actually are they living more of those years in good health? And the trend has been that they're not. So we want to try and see a kind of real improvement in some of these outcome measures. But alongside that, what we've also got to do is just make sure that we are delivering services that meet a acceptable standard on a day-to-day basis in terms of how they're delivering, in terms of good waiting times and responsiveness to patients. We'll be looking at measures of NHS service quality and measures of NHS productivity and efficiency. So there'll be lots of different layers to this, but overall there's going to be that real shift in the focus towards measuring outcomes.
Well, look, thank you both very much indeed. Of course, the copy of the strategy and the plan will be on the intranet, so colleagues, please have a look at that. Is there anything else you'd like colleagues to be aware of with regards to this work at all at this time?
I think the main thing to say is that this strategy and plan is around trust that we can work differently together and keep that focus on outcomes. We can only deliver this really together, and that's in its broadest sense with our partners and those who we serve.
Super. Alex, Richard, thank you both very much indeed.
Thank you, Simon.
Thank you.